some vet-related questions that you guys asked. So think of this as like a pre-vet consult. Thank you so much, Doc. Our first question from one of our followers is, my cat's poop has blood. Is it okay?
So whenever we do see blood, it's not normal. So syempre, normal stool would be, there would be a good texture, it would be formed. Okay, so kapag may diarrhea, it's not normal. It would be best to know what's causing yung blood niya sa stool. It could be parasitic kasi, it could be gastrointestinal issues. So yeah, best to check what kind of problem they have in the gastrointestinal tract para alam din natin kung paano i-treat.
Does cleaning your cat's ears hurt them or is it safe to?
Pag sanay naman sila, hindi naman. So we have a lot of clients who go here for ear cleaning kasi nga medyo natatakot yung client na pumasok super yung cotton buds. But it's relatively safe naman as long as you just don't jam the cotton buds inside. It's relatively safe. It's really good to clean your cat's ears kasi sometimes that's when we get to diagnose then if my ear scratching sila. If my ear scratching, that could indicate a disease as well.
Ganun pala yun.
Yes.
Ako din natututo. Is it okay po? My cats keep throwing up.
Okay. Yeah, so it would depend on the kind of vomit na nilalabas nila. If your cat keeps throwing up, let's say, undigested food, it could mean na mabilis sila masyado kumain. Baka ganun, baka matako ng cat nyo. Pero it could also mean that if yung vomit is yellow or it was like whitish or frothy, it would be best to check na lang din again because it could indicate a kidney problem, it could indicate acidic stomach. So yeah, we would have to know based on our diagnostic tools.
So depende din siya guys sa anong vomit.
Yeah.
Kung pagkain lang, baka
mabilis na kumain. Pwede yung i-elevate yung food bowl o kaya parang more frequent yung pagpakain pero mas onte, para slow feeding. Yun.
Next question, can the cold behavior affect our cat's behavior? So far, yung cat ko kasi less playtime, puro tulog lang.
It can affect, of course. Yeah, kasi parang tayo, ang ganda ng weather, it would be best to sleep in, parang comfy mag-sleep in. So same for weather. So same for them kasi parang you know how wild cats, they have like, or wild animals, yes, hibernation. So I think naki-kick off yung instinct nila na parang since it's cold, they have to reserve their energy. It looks like that in your reasoning.
Okay. Ayun guys. What's the best and cheapest treatment for a cat with UTI?
Best and cheapest? It would be hard kasi once you get to the point na treatment na, mahal na po talaga yun. Kasi in terms of treating UTI, marami rin nagkakos niyan. Pwedeng simple bacterial infection, pwedeng crystal. So, iba't ibang gamot din yung kailangan for this. So, I would say the best treatment would be yung prevention na. So, make sure na for male cats, mas common kasi kapag male cats nagkaka-UTI kapag di pa sila castrated eh. So, best to castrate them at an early age, yung ganun. Tapos, make sure na yung litter box nyo is marami, lagi rin naka-clean para hindi sila nag-hold ng pee. So, prevention is better than cure always.
Best medicine for deworming?
Best medicine for deworming, nakadepende ulit. So, magsasawa kayo marinig na depende yun. Because, again, if positive yung cat ng worms, it would depend what kind of worms. There are broad spectrum dewormings naman. There's also spot on, wherein it has activity against yung intestinal worms and at the same time activity against fleas. And fleas can be a contributing factor kasi too when they get worms. So, we have different active ingredients. Depende rin kasi sa timbang nila. So, kunyari kitten, syrup pa yun. Kapag older, tablet. Tapos kapag bigger than 5 kilos, heavier than 5 kilos rather, mas malaking tablet, yung gano'n. So, it really depends on their weight and if may history na sila of tapeworm or whatever kind of worms.
Pero yung parang wala pa silang history, parang siguro kitten lang. What's the best spot on agad or?
Yung best would be, syempre, we start deworming as early as 2 weeks. We start with oral. So, if napapansin nyo, if you've had your cat dewormed before, yung more common be yung blue, parang siyang bubble gum. So, we start at 2 weeks, tapos every 2-week interval din yun hanggang maka 3 doses kayo. So, pagkatapos ng routine deworming na lang, and then you can insert spot on, let's say, mga kapag 2 months na sila. That will be safe na.
Ayan. Yay! Nasasagot na yung mga tanong nila.
Go lang guys. If have more questions.
Ay, madami pa daw. Any vitamin recommendations for my cats or depende din na
No naman. So, multivitamins, as long as it's multivitamins, they're generally all the same. I just like prescribing yung mga oral gel forms or yung mga gel ones. Kasi, if it's syrup, di ba, parang makikipag-away pa kayo with your cats na parang, nagulan pa kayo, makikipag-away pa kayo. Pero if it's the oral gel form, parang siyang treats na lang. So, kunwari treats na lang siya instead of like, you know.
Gusto pa nila.
Yeah, exactly. Kasi yun nga, they might have that bad association of vitamins and medication. So, in the future, mas mahirapan pa kayong magbigay ng medicine din.
So, ayun, gel. What's the most recommended or best diet for cats? Is it wet food, dry food, or both?
The difference between the dry food and wet food, frankly, would just be their moisture content. So, in terms of yung macronutrients na meron sila, yung carbohydrates, fats, protein, they're the same. Mas marami lang talaga moisture yung sa wet food. So, it depends on the temperament of yung cat or yung behavior ng cat. If hindi siya matubig or hindi siya mahilig uminom ng water, the best would be wet food, of course. Pero, if okay naman siya, uminom ng water, okay lang din mag-dry. So, either way, they're going to get the nutritional requirement that they need. You can use actually both dry and wet kasi ang dry food naman, it's good for their dental health. So, kapag dry food, nagkakaroon kasi siya ng friction from the food and the teeth. So, nagkakaroon ng less chances of tartar and plaque build-up. So, yun naman ang pros ng dry food.
I see. Ako din natututo talaga. Okay, next is, how do you train your cat to use the litter box? Parang ngayon tayo ba nagtatrain? Hindi ba yung mommy na nila? Yun yung
kasi kunyari pag na-rescue mo na,
diba,
ng older, mas mahirap. So, personally, yung ginawa namin, I've rescued a couple of cats din kasi. Kunyari, they have this like spot na mahilig sila mag-pee. Doon ko nilalagay yung litter box. Or at the same time, if may pinupan sila, kinukuha ko yung poop, nilalagay sa litter box para at least na-associate yung smell din or yung area. So yeah, pero if they're kittens pa lang, they, once you put a litter box near them,
alam na nila.
Talino sila.
Talino pala. Yung kuya ko din po kasi parang yung our first cats.
Yeah.
Parang pag may position daw sila, tapos pag alam niyang ilalagay niya lang sa litter box.
Yun na lang. Kasi ang recommended natin na litter box and cat ratio would be 1 cat, 1.5 litter box. Yun. So if you have 2 cats, 3 litter box. Pero yan, 3 litter box. So, it's best na mas marami ding litter box nga para at least hindi sila nag-hold or umiihi kung saan.
Ano po gamot sa kati ng pusa? O di ba guys, hindi ko alam paano ko yun.
Depende again. Yun, it depends kasi maraming cause ng itchiness with them. If it's a skin problem, it could be fungal infection, it could be a bacterial infection, it could be parasitic as well. So we don't have a medicine that treats everything. So we have to know the cause, to know the proper treatment. Kasi baka bigay ng itong medication na to tapos iba pala yung condition ng cat. So you don't have the proper treatment. So it depends.
Pero minsan, Dok, kung wala yung pusa ko, minsan nanganganog sila. Normal po ba yun? Parang ganun lang.
Okay lang. Oo.
Ganun lang, wala. Ganun.
Okay lang. As long as it's not excessive. Yung grabe na. Tapos nagsusugat na yung behind the ear. Yun, excessive na yun. And
ano na talaga.
Yung nade-disturb na yung daily life nila or something.
Ito naman po daw, ano naman po daw gamot sa sugat ng pusa? Ano sugat, guys?
So, there are different kinds of wounds then. So, kung wound yan na malaki, baka kailangan tahiin yun or something. If it's, or pwede ring secondary intention healing wherein you let the skin heal on its own. Pero kung maliit lang naman, kahit general wound management, just keeping the area clean, the body knows how to heal itself naman. Pero if there is an infection, we do recommend antibacterial ointments. Tapos yun, depende na nga lang kasi yung extent ng sugat. Kasi kung malaki na, kung infected na, baka mag-oral antibiotics pa kayo dun. So, depende sa assessment ng sugat.
How do you make a cat cuddle with you?
Ayun din yung problem ng sister ko with her cat. Kasi super masungit. So if you notice like calico cats or girl cats, medyo mas ano sila, mas mataray sila as compared to boy cats. I don't know, diba? Super cuddle sila. Super makadal sila. So, I think with, if rescued yung cat, you have to earn their trust first. So, yeah, earn their trust. And it just comes after, I would say. Pero depends sa personality.
Parang pag na-in-love na siguro sila sa'yo, di ba?
Yeah, pero meron din mga cats kasi na hindi talaga makadal eh. So, wala, stock na kayo. Kuha na lang ng ibang pusa.
Mag-adapt pa ulit kayo.
Oo, get a second cat. Adopt ng adopt hanggat makuha ng malambing.
Kasi yung kahit anong araw, anong time.
Di ba? Mas malambing ang boy cat. May bias.
Why and when should your cat get vaccinations and which vaccination should they get?
So, we have our core vaccines. So, ang core vaccines kasi natin, it includes 3 to 4 viruses. So, FPV, FHV, FCV, tapos chlamydophila-psittaci. So, that's what's included in our 4-in-1. Of course, it's very important to get yung core vaccines to protect them against these viruses. So, we start that as early as pinakamaaga, I would say, would be 6 weeks. Pero ang practice namin dito sa clinic would be 8 weeks kasi medyo mas mahirap kapag less than 1 kilo yung cat eh. Kasi ang onti ng skin na pagtutusukan nyo. So, kapag dumating na sa 1 kilo, it would be easier. O kaya like 0.9, 0.95, it would be a lot easier. And then, that's 3 doses, 3 to 4 weeks interval. So, yun, it's very, very important because it protects them from the viruses that can potentially cause harm from them. So, apart from that, anti-rabies, of course. Anti-rabies, nakasulat yun sa batas na kailangan ng all your cats, all your pets, they need to be vaccinated against rabies.
Ang galing nito!
Thank you.
Why don't cats like water? Ano ba yun?
Well, I would say that's stereotype ng cats. Kasi we do have cats naman na okay silang gina-groom. Especially kunyari for longer cats, mas kailangan silang i-groom. Pero kunyari pag short hair, marunong naman sila mag-groom themselves. But if I were to answer the question, I would say it comes from their heritage din, from their ancestors. Kasi ang cats, ayaw nilang masyadong na-restrain or ayaw nilang ayaw nilang na-restrain or na-restrict. So I feel like when they're wet, parang it feels restricting for them. But yun nga, depende kasi yung cats naman, yung ibang cats mahilig sa water.
Pero sa TikTok yung
yung shower. So I feel like that thing is stereotype.
I need tips po when traveling with my cat.
Saan ba kayo punta?
Ilang hours to.
Ano nga, baka dyan lang pala sa
Please.
Yeah, but for my clients who have cats na nag-abroad na sila, nag-migrate, we give anti-anxiety medication. It's gabapentin. You should consult your vet kung ano yung proper dose kasi nakadepende rin yan sa weight nila. But gabapentin is an anxiolytic medication that calms them down, especially kunyari matapang din yung cat, spicy sila. And then they vet check, gano'n. So para mas kalma sila before they go to the vet, we give them gabapentin at least 2 hours before. Para when they get here, madali na lang kunan ng dugo, madali na lang everything. But yeah, usually that's what we prescribe for when you guys need to travel, kunyari via boat o kaya airplane.
Pero paano daw kung parang car lang? Like,
pag car, kunyari pupunta rin tayo sa probinsya, pwede rin. Kasi some cats, they get really stressed during travel. Like, nag-vomit sila, nag-diarrhea sila. So, if anxious talaga yung cat nyo, it would be best to give anxiolytic medication.
Ayan. Ate, nakalimot po ako ng pusa pero may bakuna naman na po siya. Paano po yun?
Ay, human doctor pala.
Ay, doctor na din.
Parang punta po kayo sa doctor niyo. Pero, ayun, if the cat is, I mean, I'm speaking as a vet, if the cat is vaccinated against rabies, you're supposedly protected. Pero, of course, consult your physician to know better kasi, you know, may mga protocol din yan. Yeah, tanong nyo na lang sa doctor niyo, please.
Ito comment lang to eh. Wow, ang tataba naman po nila, ba't mga pusa ko hindi mataba? May cause ba yun, yung weight or
Medically, yes also. So, number one question is, castrated or spayed na po ba yung cat nyo? Kasi kung hindi pa sila castrated or spayed, all their energy to like take care of themselves napupunta sa paghanap ng mate. So like maglalandi sila, they're gonna go out of the house. Minsan hindi pa kayo pinapatulog niyan. Minsan hindi sila natutulog at all trying to find the mate. So yeah, yun lang. Pero kung hindi pa rin sila tumataba, even after that, there could be an underlying medical condition. Like in terms of, pag super payat, like super kain ng kain, tas payat, it could be a hormone thing. But also, we have to rely on baka pala sa tingin lang natin payat. Diba? So, pa-check natin kasi baka normal weight naman pala.
Yeah. Guys, baka hindi naman. See you na borderline overweight.
Diet yun na.
Diet. Is hairball puking normal?
Hairball puking is normal, especially for long-haired cats. So, yun, since marami silang, every time sila nag-groom sila, pumapasok yung hair, tapos nilalabas lang din naman nila. So, hairball, as long as it's hairball, it's normal. Again, if yung vomit is yellow, if vomit has blood or whitish, that's when you have to go to the vet para at least alam nyo yung reason why.
Pero, Dok, kumari hairball, tapos may kasamang yellow or may kasamang white. Paano yun?
It would depend na. Kasi, is it hairball all the time? Yung frequency din ng hairball. So, yun, nakadepende na siya case per case basis. Pero as long as it's hairball, tapos, as pet owners, malalaman nyo rin kasi yung frequency nun eh. Kung gaano kadalas, you know your cat best. So, if ma-increase siya,
parang every other day.
Grabe
na yun.
Baka na yun. Somehow, at least if concerned sa inyo yung hairball, we can give also supplements that can help yung sa hairball. Like more fiber is good for them. Yeah.
Pero mas better pa, Dok, if magtais sila nung itain na lang nila yung hairball.
Sometimes kasi we do have cases na nagiging obstruction nga yung hairball. So that's when it becomes a problem. So that's when we also give supplements para yun. With hairball naman, most of the time, it's vomiting talaga.
Ayun. Next, is it okay to bring your cats outside or during pasyalan?
If fully vaccinated, it would be safe. Yeah. Pero kasi kung hindi nga vaccinated, syempre, kung you're may contact with other cats, hindi yun safe kasi baka kung ano rin yung sakit na makuha nila. If wala naman silang contact with other cats, baka kapag pinalakad niyo sila dun sa park or whatever, may contact pa rin yun, like even indirect. So, it would be best na if you want to go outside with your cat, they have to be fully vaccinated at least.
Hindi po ba sila nasa-stress? Or depende po yun sa personality?
Yeah, depende sa personality din. So, kung chill lang naman yung cat nyo, like, kahit sino humawak, okay lang. Dali, okay lang. Pero if it's going to be more stressful for them, wag na lang. Kasi, pag na-stress din ng cats, they're easily stressed pa naman. Pag na-stress sila, bumababa din yung immune system nila. So, kapag bumaba yung immune system, of course, they're more prone to getting other infections. So, yeah.
Ayun.
Baka mas mapasama pa.
Huwag na lang. Sa bahay na lang.
Pili ko na ito.
Gawin mo na. Diyan ka na inad. Nagkapit natin niya ulit. Ulit. It's pretty so cute. Ito lang yun. Are there any requirements before neutering or spaying? And also, what do you do after?
Yung post-op care, I would say. Okay, so one of the main requirements that we ask our clients to do would be the pre-operative blood works, wherein we get the CBC, complete blood count, and the blood chemistry. So sa CBC kasi, this is where we check yung 3 major blood groups. Dito natin nakikita if there's any kind of infection, any kind of anemia, and if mababa yung platelet, it would cause more bleeding or mas prone magkaroon ng bleeding. Another thing in sa blood chemistry, it's important to check the kidney and liver parameters kasi they're going to undergo anesthesia. So if they're going to undergo anesthesia, we want to make sure that both organs are okay kasi si liver yung nagme-metabolize, si kidney yung nag-excrete. So kapag may problema with either one of those, magsistay si anesthesia and that would be harmful for the cat. And recommended of course na completely vaccinated, fully vaccinated na kasi the whole process of surgery is stressful for them. And again, as mentioned earlier, when cats get stressed, their immune system decreases. So, if hindi sila vaccinated, tapos na-stress sila, mas prone din sila magkaroon ng kung ano-anong sakit. In terms of their post-op care, they're going to have to give, or you're going to have to give antibiotics to them. Wound management, of course, very, very important. Kunyari, isa-spay niyo yung cat nyo. Dapat naka-e-collar all the time. Kasi marami kasi kaming cases na naawa po kami doon, tinanggal namin. But then again,
kayong maawa!
Kayong maawa! Kasi
mas kawawa niyo po pag tinanggal.
Yun, kasi kapag nalik nila yung area na yun, magkakaroon ng infection and we'll have to do surgery again. We're gonna have to repair the wound. So, always keep the e-collar on, always do your wound cleaning regularly, always give the medication on time then. But yeah, yun lang naman yung for post-op care.
What's the best age for them to get spayed or neutered?
This is this is also very important kasi I would say 6 months. 6 months kasi is their first heat cycle. Supposedly before that or kapag nag-heat cycle na 6 months. Kasi if you spay your cat before the first heat cycle, it reduces their chance of mammary cancer by like 86 to 90%. Yes, and ang hirap po kasi ng mammary cancer or mammary tumors, at least in cats, kasi 90% of mammary tumors could be cancer. So yeah, it's best to have them spayed early kasi kapag yun nga, spinay niyo sila early, less na talaga, 86 to 90% bigla yung pagbaba ng risk of them having cancer. So it's very, very important. In terms of male cats naman, they have behavioral things kasi diba, yung nagsaspray sila kapag they want to mark their territory. So if you do castrate them early on, at least wala pa silang behavior na gano'n, and at least hindi pa naging habit yun.
Hindi pa nila alam.
Hindi pa nila alam. Tanggalin nila. Snip na. Yeah, yun.
Pero Doc, meron yung parang isang vet sa, hindi ko na alam kung saan ko nakuha ang source, pero mas maganda rin po ba daw if like medyo older, 1 year sila, gano'n?
There are well, kasi kunyari kapag 6 months, that's why hindi kami nag-spay ng below 6 months din. Kasi mas manipis pa yung uterus, yung uterine horn. So, it would be harder to do the surgery kasi it's fragile, it might break. Maybe that's why ni-recommend na mas older din. Then, there are also,
So, yung kasi maliit yung
uterine horn niya.
Yung balls niya. Very small.
So, for male cats naman, kapag 6 months tapos hindi pa nag-grow yung balls, pinapa-wait pa, of course, to a point na it's big enough para makastraight sila. Mas snip-snip.
Ayun. What are the most common diseases in cats and how do we prevent it?
Okay, most common diseases, I would say we can classify it based on their age also. So, if kittens, of course, mas prone pa sila magkaroon ng viral infection. Feline panleukopenia or feline parvovirus, this is very, very common in kittens. Herpes and calicivirus also very common in kittens, especially kapag unvaccinated. For older cats naman, or adult, let's start with adult. Kapag male, common sa kanilang UTI. So, yeah, that's one thing to watch out for. Kapag senior naman, it's more of metabolic diseases. And when I say metabolic diseases, it could mean kidney problems, liver problems, hormonal problems, diabetes, chronic kidney disease, yung mga ganun. So, yeah, it's why we have to, even if wala kayong nakikitang any clinical signs, best to check them na para at least meron tayong baseline values and we get to detect it early on so that we can treat early on as well. So, that's how we can prevent it. In terms of, dun sa kittens naman, vaccination again, of course. Dun sa UTI, early detection din yun. So, castrate them early, give them lots of water, more on management. So, yun.
What are the symptoms na may feline asthma sila?
Feline asthma, I would say the number one that I see in my patients who have feline asthma is coughing. So, coughing, para siyang nag-vomit pero walang ma-vomit. Ganun yung itsura ng coughing. Okay? Yun, coughing talaga. Tapos, you get to diagnose it through x-rays din, history taking, if napansin niyo nangyari siya after ma-expose to like an allergen or something. So, you have to know or you have to be able to see the pattern or whenever they do have that attack. So, yeah, x-ray is important, history taking important. So, yeah.
Best cat litter plus healthy diet.
Best cat litter, I would say cat litter that doesn't produce any dust. Kasi syempre kapag dust, it can cause sneezing, allergies din sa kanila. So, I would say tofu litter would be one. Kapag ginagamit yun, wala masyadong dust. Another option would be cassava litter. I think hide and seek has cassava.
My favorite.
Yeah, favorite pala niya. So, tofu, cassava, that would be good choices. But then again, it's also trial and error. So, if na-try nyo na yung two, tapos ganun pa rin, you can of course switch to other things that work for you.
Do you recommend bentonite or not really?
Bentonite kasi, okay naman siya sa ibang cats, pero most of the things that we recognize when they use bentonite will be dusty kasi, so, or, yun nga, nakakapag-cause siya ng sneezing.
Does my cat still need a vaccine or visit the vet even if he survived parvo? He recently battled the disease and fortunately he's well now.
Okay, that's good, yeah. So, very, very important, of course, ma-vaccinate kasi you don't want that to happen to your cat again. So, what you went through your first confinement or through the first parvo of your cat, syempre ayaw na natin mangyari yun. So, vaccination, it provides protection against these viruses and it doesn't provide 100% protection but it does provide protection. And I think yun yung important. So, yeah, kailangan pa rin yung mag-visit ng vet para at least alam natin yung state niya, the things that we have to give, vitamins, medication, para makadetect din tayo ng kung ano-ano. And then, vaccination, very important, yearly yan once we finish the initial doses.
The last question. What kind of vet do you recommend and where is it?
Siyempre, Costos! Costos! Oh my gosh, so yeah, I would say, yeah, a cat-friendly clinic, one where your cats don't get stressed at all. Because, fun fact, if your cat gets stressed, it can affect the values of yung blood works nila. It can, all my clients know this. Minsan, pag nag-explain ako ng blood works, parang, tumaas po kasi na-stress. So, to be able to lessen that stress, we have more accurate presentation of tests. We have an accurate diagnosis as well. So, yeah, and yun nga, behaviorally, mabilis talaga ma-stress ang cat. So, kailangan ma-factor in yun. So, kung sinong vet, eto.
Ito na po.
So, yeah, the cat clinic, we have 3 branches naman. Kung saan kayo malapit.
Ang daming branch. Baguio branch. Yan lang, guys. Thank you so much for watching and baka may gusto po kayo i-plug.
My IG, DrTashasNTS. There!
Yeah.
I just made one for you guys.